This meeting is being recorded.
Good evening, ladies and gentlemen. Thank you so much for joining us today for this session, which is an information session. We're going to focus on our Beat1 as well as our Beat1 network. My name is Gary Makakula, and I'm the Key Account Specialist for Bestmed. With me is a panel of experts that will be assisting us with questions and answers. We will still also be available to answer any questions at the end of the session. Just for the purpose of this session, to allow others to join, I'd like to give maybe just another couple of seconds, then we can be able to start. Okay, I think I could be ready to start. They can join us in. Once again, ladies and gentlemen, thank you so much for joining this info session. It's called the engagement session. The purpose for them is for us to have a virtual engagement with our members in different options for them to be able to understand how their option works. So with Bestmed, we've got a total of 10 options, which is Beat1, Beat2, Beat3, Beat4, Pace 1, Pace 2, Pace 3, Pace 4, as well as our capitation option, which is our rhythm, which is rhythm 1, as well as rhythm 2. The purpose of this session today, we're going to focus on each and every individual option per day. And today's focus will be on Beat1 as well as our Beat1 network. The agenda will look into our hospital benefits, out of hospital benefits, benefit for medication, maternity benefits, preventative care benefits, our tempo offering for 2023, contributions for 2023, our Bestmed app, and then we'll be able to take questions and answers. Like I did say, you're more than welcome to ask any questions on the question and answer button, and then the expect of our colleagues will be able to answer those questions in the meantime. Beat1 is purely our hospital benefit cover, and it's got very limited out of hospital benefit, which we pay for, no functionality to any savings account. Service rendered in hospital, there is no overall annual limit, so we will pay for full claims at 100% of scheme's tariff. For Beat1, it will be at any private hospital, and we've got our Beat1 network, which is through our network hospitals, that is Mediclinic, Life Cover, as well as others. The difference between our Beat1 and our Beat1 network is that our Beat1 network is 10% cheaper than our Beat1, which is the EDO option, efficiency discount option, that we've made available for our Beat1 option. So these EDO options, which is efficiency discounted options, are available on our Beat1, Beat2, as well as our Beat3. What is important, the treatment in mental health clinic in this Beat1 option is limited to 21 days per beneficiary per year. Treatment for chemical and substance abuse, limited to 21 days, up to a rent value of 35,573 per beneficiary, subjected to the network facility. Medical measure maxillofacial surgery is covered as prescribed minimum benefit at any designated service provider, day hospital. Dental and oral surgery payable from as prescribed minimum benefit also from the designated service provider. Internal prosthesis, spinal is included on the artificial disc as single level base, which was previously excluded from this benefit. Continuation of our hospital benefits. Functional prosthesis is limited to 31,000 rand. Palliative care as well as home-based in hospital, up to a rand value of 63,420 per beneficiary per annum, subjected to a pre-authorization and treatment plan. Biological medicine during hospitalization is subjected to pre-auth as well as funding guideline. Got it limited up to 10,570 per family per annum. Still have take-home medication if the member is hospitalized of up to 7 days. Consultations as well as procedures in hospital are payable at 100% of scheme's tariff. Surgical procedures as well as anesthetic are payable at 100% of scheme's tariff. Organ transplant also payable at 100% of scheme's tariff as prescribed minimum benefit only. orthopedic as well as medical appliances, payable up to 100% of scheme tariff. Continuation, in-hospital pathology, payable at 100% of scheme's tariff, together with basic radiology, specialized diagnosed images like your MRI as well as CT scans, payable at 100% of scheme's tariff. We've got cover on Beat1 for oncology treatment, which is cancer, payable at 100% of scheme's tariff. Pre-authorization is required and make use of designated service providers as well as our treatment protocol. We've got confinement cover, which is for pregnancy, payable up to 100% of scheme's tariff. Refractive eye surgery, payable as PMB. Supplementary services in hospital at 100% of scheme's tariff. Day procedures at a day hospital facility, payable at 100% in the network or scheme tariff. The patient who voluntarily choose to make use of the procedure done in general hospital will instead have a 2,500 Rand co-payment. We've got an exclusion on the Beat1 option, which is for joint replacement for planned procedures. In the case of an emergency, which is prescribed minimum benefit, it will then be considered. Continuation, the difference between our Beat1 as well as our Beat1 network. For our Beat1 network, the patients are restricted to a network facility with the link there when this presentation will be shared. In case of an emergency, can be admitted to any hospital, but as soon as the patient is stabilized, they will be transferred to a network option. If you choose to make use of a non-network hospital voluntarily, then there is a co-payment of 13,078 Rand that will be applicable. Hospital authorization on Beat1 as well as Beat1 network. The number to call for authorization is 0800 220106, or you can send an email to authorizations@bestmed.co.za and provide us with the most important details, which is your member number, dependent code of patient, treating doctor's practice number, hospital practice number, date of admission, as well as the ICD-10 codes. Out of hospital benefits, there is limited cover for hospital out of hospital benefit on these Beat1 as well as Beat1 network option, which we will cover for wound care benefit up to a Rand value of 3,885 per family per year. Oncology, which is then the cancer treatment, will be payable at 100% of scheme's tariff. Pre-authorization is required. HIV as well as HIV and AIDS treatment is covered at 100% of scheme's tariff. Pre-authorization is required at any designated service provider of the member's choice. Diabetes primary care consultations up to 100% of scheme tariff, subject to registration with Hello Care. And we've got 2 primary consultations that will be payable through our discount pharmacies. We've got specialized diagnostic images, which is MRI as well as CT scans, which is payable at 100% up to a Rand value of 5,885 per family. Rehab service after trauma, payable as prescribed minimum benefit. Pre-authorization is required. Our designated service provider, which is our DSPs. The scheme basically has contracted providers that includes doctors, pharmacies, as well as hospital to provide treatment care for prescribed minimum benefits as well as other services. If a member uses a non-DSP, they may be liable for co-payment and difference between what the doctor is charging as well as the scheme's tariff. The types of network with our designated service providers, it's mostly applicable to prescribed minimum benefit conditions that are paid by the scheme's risk. Providers agree not to ask any high rates, so we negotiate with those providers to charge us according to the medical scheme's tariff. With regards to that, in case of an emergency, then the use of a DSP will ensure full payment. How our services providers selected, we've got our service provider department, where any specialist who is in good standing with the HPCSA is chosen to join Bestmed's DSP network, and they're welcome to do so. We send a bulk invitation to all those network doctors, and we invite them to join our network list. Joining the network is voluntarily. Obviously, we won't be forcing any doctors to do so, and it's up to the choice of the provider to able to join us. Those who are viewed as best in the fields where there are limited services and they have scarce skills, we approach them directly as well as personally, and we invite them through our network department. Non-DSP specialists preferred by Bestmed may also be invited to join the network. PMB procedure. If a patient or member needs to be treated or cared for in condition of qualifying for prescribed minimum benefit, the member is required to make use of designated service provider on Bestmed network to avoid co-payment. So this is to ensure with regards to our designated service provider that the members by all means avoid to make any co-payments, which will be the difference between what the doctors will be charging as well as the amount that the medical scheme will be paying. The reason for that is according to the medical scheme, a scheme is required to pay prescribed minimum benefit treatment at cost, which is an invoiced amount. Scheme may form a network provider list where they select and only reimburse non-DSP members to up to a DSP scheme's tariff. If no DSP provider is available within 50 kilometers of your radius, any provider may be used and the PMB funded will be paid in full, as long as the member did not pass the designated service provider to make use of a non-designated service provider. So if you are 50 kilometers radius long, then you may use a service provider that is not on the list, but you can't pass a service provider that is on the list to make use of a non-service provider that is on the list, if that makes sense. In case of an emergency, where the member did not have a choice or involuntarily had to make use of a non-DSP service provider, then the DSP rule will be waived and a prescribed minimum benefit claim will be paid in full. So finding of a network, it is available from our website, www.bestmed.co.za, or chat functionality with the link. Bestmed Contact Center at the number 086-000-2378, or our email at service@bestmed.co.za, or we can make use of our Bestmed app. Procedures for PMB in case of a very complicated and you have not received any advice you need. For an example, there is a non-DSP closer than 50 kilometers, but you refer to another DSP. The specialist is the best option, but not on the network. You are ensuring the provider that the network can assist you with your procedure or diagnosis. Please contact our special team through specialist@bestmed.co.za. Process for in-hospital PMB. We do require pre-authorization for hospital admissions, where you call our contacts number, which is 0800 220 accounts paid at Bestmed's tariff. If diagnosis is valid, PMB, then the practice number can apply to have a shortfall for related in-hospital account cover. Our contact number for call center is 0800 000 2378, and they will send relevant documentation to the prescribed minimum benefit departments for process. The Beat1 as well as Beat1 network have got benefits for chronic and medicine and treatment for conditions listed as the chronic disease list, as well as prescribed minimum benefit listed. We have 27 chronic disease list, as well as 18 prescribed minimum benefit conditions that we do cover in this benefit, as much as is just an hospital benefit cover only. The listed 27 prescribed chronic disease list, these are the listed 27 chronic disease lists that we cover on this option as Beat1 that will qualify for chronic, and with the cover for their medications to be funded for under our chronic benefits. Our chronic disease list. Obviously, then the treatment for the 27 chronic disease list that scheme must cover according to the prescribed minimum benefit provision. Treatment must be provided according to the standard treatment algorithm for each CDL condition. The medical scheme must also provide cover for related doctor's consultation, test-related condition. This is called a treatment plan and specifies the annual quantity for consultation as well as related services. Process to get authorization for chronic medication. So as much as you are in the hospital benefit cover only and still do qualify for chronic procedures or chronic medication, the patient and the treating doctor will be required to complete a chronic medication application form. It is advisable that you present the treating doctor with a copy of the medicine formulary to avoid co-payments. and this applies to a specific Bestmed scheme option. If a new member was registered on chronic with their previous scheme, so if you are joining Bestmed on Beat1 and coming from a previous scheme, then they may submit a chronic letter along with a copy of the latest prescription for registration. And all chronic-related queries must be emailed to medicine@bestmed.co.za for processing. Our Beat1 network. Members will need to utilize network pharmacies for their medication. So if you have selected the EDO option on Beat1, which is a network option, then for your chronic, you may use our network pharmacies, which is Discam, Clicks, Vanierden, MediRite, Pick n Pay, as well as MediPost. What is required to register medication on chronic? For first-time applicant that will be joining us effective from the 1st of January 2023, we need a completed and signed application form with supporting information as specified for the condition. New medicine added to existing authorization or to update an existing authorization, we just require a copy of a new prescription with supporting information. Complete information to be emailed to medicine@bestmed.co.za. And we do have telephonic authorization where the doctor can speak to one of our experts in pharmacies department, and they'll be able to be advised and assisted. With regards to medicine related to prescribed minimum benefit condition, we've got the 18 prescribed minimum benefits set as a minimum benefit, which by law must be provided to all medical scheme members, include provision of diagnosis, treatment, as well as ongoing costs. Prescribed minimum benefit as follows. These are the 18 prescribed minimum benefit conditions that we do cover, and inclusive of our Beat1 as well as our Beat1 network option. Our registration for PMB. You need to download the PMB registration form through our website, have a specialist to complete it through and send it back to pmb@bestmed.co.za. It is important that the designated service provider network is applicable. To avoid co-payments, we've got a list of formulary lists per conditions that we cover, and all Bestmed formularies, which includes the CDL as well as PMB, are available on our Bestmed website, www.bestmed.co.za, with the CDL as well as PMB conditions. Items that are not on the formulary, there is a 30% co-payment. So if your doctor has selected medication for your diagnosed condition and that medication is not on the formulary, there is a 30% co-payment applicable. That is why it is advisable that when you complete the application form for chronic, you do take a copy of the formulary list so that the doctor can select or prescribe medication that is on the formulary to avoid co-payments. Formulary medicine is not automatically approved, so pre-authorization is necessary to gain access to medicine benefit. What can be done to avoid medicine co-payment is to make use of our formulary list, use generic medication with prices that fall within the MRP, use a designated service provider that does not charge higher dispensing fees. Notifications from chronic medicine department. There is an SMS notification. When a chronic application is received, then the chronic application has been completed. Authorization expires to prompt authorization renewal. Real-time SMSs at point of claim will be sent out to avoid co-payments. Possible chronic.
Ladies and gentlemen, we do apologize for the glitch that we just experienced now. I will try and continue from where our previous presenter left off. I think the last few slides were from the SMS and the process regarding registration. Okay, so with regards to SMS notifications, you will then register for chronic, and then you'll be in a position where once you've been granted authorization, you're then in a position where you granted the necessary medication according to the formulary. Obviously, like I already mentioned, that non-formulary medication might occur over the counter, not over the counter, sorry, but a shortfall based on the fact that it is probably not a registered medication. Remember that authorization needs to be granted, and in not every application actually warranties that you you granted chronic after applying. So it is important that you contact us, and if it's a possible chronic, then it will be granted. We do have a department that deals mainly with this, and they do provide with the necessary information with regards to a decline as to whether if we do decline that and the reasons behind it. Next slide. So from an acute medicine point of view, the prescribed medicine for conditions that are not listed as CDL or PM conditions are usually paid from funds if you have a savings account. So in this regard, because you are on Beat1, you do not have a savings account, there is no bucket for chronic, for acute medicine. So that's where the difference is. Sorry that we're using an incorrect slide at the moment, but over the counter, you will not have this as part of you belonging to a Beat1 option, because like we mentioned, it's mainly a hospital plan with a little bit of cover, mainly on the chronic side of things and PMB. So you will not have the over-the-counter part because of the fact that you do not have a savings account. Next slide, Bo. Okay. With regards to maternity benefits on the Beat1 and Beat1 network option, I would like to think these are the benefits that are available in terms of you being belonging to a Beat1 option. So you are entitled to 6 antenatal consultations and through a gynecologist and midwife. So overall and above, remember that the benefits regarding maternity are very limited, mainly because you belong to a Beat1 option. So be wary with regards to getting the necessary information should you need this benefit in terms of the fact that you don't have you do not have benefits outside of your hospitalization, but we do grant this as well. Move right along, Paul. Thank you so much. So annually, you are granted with vaccinations for flu, pneumonia vaccines, female contraceptives. The list go on and go on. So outside of your normal, hospitalization benefits, these are the benefits that we grant you as a member, especially seeing that you're also on a Beat1 option, to say outside of what we have granted, you are also granted these benefits. So we encourage that you do go for your mammograms if you are females above the age of 40, and every 24 months you are able to go for mammo scans. So these will form part of your preventative care benefit and are scheme, or let's call them risk benefits, like we do in terms of benefits that are outside of your normal, Beat1 benefits. Pre-authorization is usually sometimes required, just so you can get a certain benefits, especially for the back and neck rehabilitation programs. Next slide. Tempo is our wellness program, which has been running very successfully for the past 5 years, if I may recall. So we would love that our members stay fit, healthy. And these are the journeys and the legs that are part of the Tempo benefits. So we've got the fitness, we've got the nutritional, we've got the emotional journey, which I'm very passionate about, which we just launched now via Psyched, where members have got certain benefits outside of the normal benefits with regards to mental health. As we are all aware that mental health is on the rise, especially lately after COVID, post-COVID, and we're in a position that as a scheme, we would love to ensure that members do register for the emotional well-being part of it. You download the app and you get certain benefits. You can speak to a psychologist, you can get information from our library of information and so forth and so forth. And then we've got the preventative care part of it as well, which I've already mentioned. So before I repeat myself, the process to follow with our journey is that you need to go for a health assessment. A health assessment gives us enough information at the scheme with regards to know where you are currently with your health. Once your health assessment has been done, it is sent through to our system. We give a report, and at the end of the day, this benefit is available even if you are a corporate member or just an individual member. So we advise that you go to our Clicks pharmacies or Discam where you get those benefits. And then from a fitness point of once now you have gone for your health assessment, it opens up and unlocks certain benefits. Now you are able to go for a fitness assessment with a biokinetist. There's a follow-up session, be it virtually or one-on-one, where now, because you have gone for an assessment, then there's certain areas of your life where you probably need attention for, be it you've been suffering from a knee problem that probably can be fixed through certain exercises and so forth and so forth. So these are the benefits that we offer from a fitness point of view. So we call this our fitness journey. The next present slide. And then we have also our nutritional health journey, which we will be launching in 2023. But at this point in time, you are able to go see a nutritional a nutritionist once you've done your assessment as well. The consultation can also be done via virtually or one-on-one. And we do have a list in certain areas where we can the Tempo team can provide you with a list that is of nutritionists that you can go visit. So these are benefits that are outside of your normal benefits. They come from your preventative, not from your Tempo wellness assessment. Next slide, Mpo. Like I told you, the emotional journey, which I've already mentioned. It is, we have an app that we advise members to go download. So we will advise that you download the app, be it from the desktop or from Android, and your full guide on emotional well-being will be on the app. So we encourage that our members go for this so that they get a library of information. They can speak to specialists. You can also do a test and assessment as well. It doesn't diagnose, but it gives you a guideline of whether, sometimes you're feeling blue, you're feeling overwhelmed, and you're in a position where you're not too sure where to go. So the necessary guidelines are provided to say, I want to speak to someone, and then there's a button you can click, and then you speak to one of our qualified psychologists to deal with your current situations. So like I said, it is just, a guideline. Interventions, deeper interventions with regards to mental health, which we need to take seriously as individuals, are part of, will form part of the app and are in a position where, you will receive all the necessary guidelines. So I advise that you do download our app and follow the guidelines. We have already sent information to each individuals. We've sent letters on how to download, the steps to follow, and the benefits of that. Next slide, Mpo. Okay, that is just a process or what you will see when you go into our emotional well-being section, and it will just, it's user-friendly. You will then go into the emotional well-being site, and then it will guide you step by step on what to do. Contributions. So if you are on Beat1 network, principal member will contribute 1,710, and then an adult dependent 1,329, and per child it's 720. This is the members that are on the network option, and the members that are on non-network. That's the contribution reflecting there, which is 1,901 for a principal member, an adult dependent 1,475, and a child dependent is 799. To reiterate what Gary mentioned, network, you are restricted to a certain networks, and the non-network, you are open to go to the hospital of your choice should you need to. So members will only pay for the first 3 children, and then the rest are covered and are free. Child dependents, just as a reminder, are covered up until the age of 24, and registered students from the age of 26. So after the age of 21, you do not need to submit any proof. The child is covered. It's only after the age of 26 where we want now student proof. The Bestmed app. This is a guideline of the app. So you visit the App Store on your phone and you search for Bestmed app. You then download and then you register. Make sure that you keep your login details for next time. This is now for new users. And then you log in. If you have already, you log in if you have not created an account, meaning you have to create an account. You can click on the remember button, which helps me at times if I forget to my login details. Oh, okay. Should you have questions and do not probably or can't raise them at this platform, we advise that you send them to escalations@bestmed.co.za. We've got a team of experts that are available to assist you from that point of view. So the purpose of today's session is 1, to remind you of your options, of your available benefits on your option. 2, to make an informed decision whether you want to upgrade probably to the next option for 2023. So we tried our level best to try and give more detailed information only on this option so that you can then have the necessary knowledge to make an informed decision with regards to an option change. So option changes are allowed currently as we speak. So from now on, if you feel like from 2023, you want to change options, it is then advisable that you speak to us if you probably need individualized information. We are able to can help you with factual information. So now we will look into the current year and see if you have any planned procedures for maybe 2023, this is the time to change options. So escalations@bestmed.co.za is your email address should you want more information regarding, considering changing options for 2023. I am not too sure if there's any questions. We still have time. We can tackle any questions for now. You can just unmute and ask a question. I'm not too sure if the Q&A, every question has been asked. Okay, it looks like most questions were answered, but I don't know if anyone wanted to ask a question that we can probably tackle while we're still here. Okay. It doesn't seem like we do have any questions. Jess, any questions? Do you see anyone raising their hand?
I reveal no raised hands at the moment. Members, if you do have a question, you can just raise your hand and then we'll unmute you and you'll be able to ask Refilo or any of the panelists the question. Thank you.
Okay. All right, so if we do not have any questions, there's the email address once again, escalations@bestmed.co.za. You can then email us and then we will attend to your questions. I do hope that you did find the information session useful, and I do apologize once again for the glitch. This is the technology world, and unfortunately there's nothing we could have done or anticipated with regards to Gary having technological issues. But you're more than welcome to email us and we will gladly answer your questions. So if there's no question, I will say then, good evening, everyone. I hope you all have a good evening. Goodbye.
Thank you, Refilo. Bye, and thank you, members.